My name is Jaye Shyken, and I'm a professor of obstetrics and gynecology at St. Louis University in the Division of Maternal and Fetal Medicine. I'm the medical director of the WISH Center, which stands for Women and Infant Substance Health, at SSM St. Mary's Hospital, St. Louis. We provide multidisciplinary addiction treatment and prenatal care for pregnant women, and we continue services for 2 years following delivery. In 2017, there were 72,000 opioid-related overdose deaths in the United States. Let us not forget, when we appreciate that statistic, that each of those deaths represents a person, and each of those persons had a family and a social network affected by that loss. Let me tell you about someone I'll call Mary. I met Mary in the hospital at 15 weeks gestation during her 4th pregnancy. She was admitted for severe hypertension and narcotic withdrawal. We stabilized her on an antihypertensive medication regimen and buprenorphine, a replacement medication for narcotic addiction. She was discharged to an inpatient chemical dependency treatment program and continued her prenatal care with WISH. She divulged that she began using crack cocaine and heroin at the age of 22, 8 years prior, and she rapidly developed addiction. She started using because she had the opportunity. Her friends brought heroin around, and she wanted to be like them. She admits at the time that she was depressed over the breakup with a really long-term sweetheart. While she saw that as the start of her misery, in fact, the seeds of her addiction were sown much earlier. Her mother struggled with crack cocaine, and later they used together. She watched her mother lose everything: her income, her home, her family, her vehicle, and her nursing license. Mary tearfully stated that she was raped at age 15. At age 24, she was nearly raped and killed, but escaped her attacker by jumping from a 3rd-floor window. To this day, she retains a fear of heights and has ongoing anxiety. Her 2 older children were born prior to her addiction, but her now 5-year-old was born while she was actively drug-seeking. Although she had achieved sobriety following that delivery, she and her partner relapsed shortly thereafter. At that time, she did not have the benefit of medication to help her maintain her recovery. She lost custody of her baby to a family member, as well as custody of her 2 other children to their sober father. To understand why someone continues to use narcotics while they're pregnant requires that we have at least a superficial understanding of addiction. Addiction is an illness. It is chronic, and it is relapsing. In this way, it is like other medical illnesses such as diabetes, hypertension, and asthma. Addiction is not a moral failing. Addiction is a brain disease. People initiate drug use for a variety of reasons: to achieve pleasure, to feel more confident, to alter painful or stressful feelings, to fit in, or to self-medicate a mental health disorder. We also believe that at least 40% of addiction has a genetic component. After a period of time, the brain adapts to the drug, resulting in dysphoria when it is not available and requiring more of the drug to achieve the same effect. Over time, the addict must take their drug just to feel normal. And unfortunately, this feeling of normalcy becomes that much more fleeting. There are changes at the receptor level of the brain that make it difficult to appreciate the things in life that would normally give us pleasure, like listening to music, eating delicious food, feeling the warmth of the sun on your face, or experience the joy of family. Further, after a period of abstinence, withdrawal symptoms occur, which are exceedingly unpleasant. What was originally experienced as an impulsive and entirely voluntary act becomes compulsive as the drive to recover from dysphoria and withdrawal intensifies. Addiction, therefore, is the hijacking of the brain's normal withdrawal reward pathway. This drug interferes with the most primal of all drives, and that is for a mother to protect her baby. Like diabetes, asthma, and hypertension, addiction is a treatable disease. It responds to a change in lifestyle and many times medication. Long-term recovery is achievable. Every woman has a story, and every story is important, and that story is the key to her illness and often the key to her recovery. In this age of trauma-informed medicine, we seek to learn what happened to you rather than what is wrong with you. When you are present with her, when you ask an open-ended question and listen to her answer, you express that she matters. It is through this kind of interaction that a patient will see herself as worthy. Our words matter, and we strive to eliminate stigma in our language and our attitude so women will seek the help that they need. Mary was a model patient, completing inpatient treatment, moving to a maternity home, participating in daily group sessions and weekly individual counseling. In addition to her medical treatment, we identified and addressed her severe depression and likely bipolar disorder. Her pregnancy was complicated due to her severe hypertension, but this was unrelated to her addiction. She required admission to the hospital for superimposed preeclampsia at 31 weeks, but she was able to carry to 34 weeks when she had an induction of labor and an otherwise uneventful delivery of a preterm baby boy who continues to do well now. She achieved sobriety at 15 weeks gestation and remains sober to this day. Purpose involves a reason, an aim, and determination. I've come to addiction medicine as a second subspecialty late in my career. And while caring for high-risk pregnancies has been my joy, this has become my purpose. All humans long for an existence that matters, for a purpose. Mary, like women I meet, found purpose in their potential motherhood. But society has told them that they are criminals and unredeemable. Each relapse is a mirror that they hold that confirms their unworthiness. Michelle Obama, in her book, Becoming, stated, "If you predict failure, you hasten its arrival." So sometimes you have to hold the hope until they can. Mary speaks about feeling good about her progress, comfort in a routine, courage in facing her darkest feelings, and safety in community. She longs to be an exceptional parent. She expresses spirituality and a great deal of gratitude. Now Mary talks about her purpose, that perhaps her addiction led her to a path to be the best mother she could be and break her family's cycle of addiction. Perhaps her addiction led her to a place that she can be of service to someone else. Now that she is experiencing her longest period of sobriety ever, she sees herself parenting with purpose and hopefully becoming a community support professional for pregnant and parenting women with addiction. And to paraphrase part of our SSM mission, in addiction medicine we say, we have to meet people where they are, but we can't just leave them there. Of all aspects of medicine, I can think of none that is more mission-driven. My team and I view our role as a distinct privilege as women welcome us into their lives during pregnancy and the few years following their delivery. We have a small but powerful influence over the trajectory of an illness during an extraordinary moment in women's lives. Recognizing that the course of this illness is modifiable makes our purpose clear and our patients' goals attainable. I am humbled to be witness to the meaning of purpose.